decap BLS stick. Deformities, contusions, abrasions, penetrations, punctures, burns, lacerations, swelling, scars, tenderness, and palpate for tenderness, instability, and cravages. Palpate back of the head, check my gloves for any blood, palpate any facial bones. Go ahead and open your mouth. Checking for any oral trauma, any singed nose hairs, looking in the ears for CSF or blood, any leakage. We're going to go ahead, palpate on the back of the spine, C2 through C7, you can't get C1. Any JVD, stomas, tracheal deviation, palpate for any subcutaneous emphysema, any medic alert tags. Moving down into the sternum, she would be still holding C-spine. Palpating on the clavicles for any subcutaneous emphysema, shoulder girdle down and in. We're going to also assess, rock the sternum for stability. Go ahead and take a deep breath for me. Checking for any flail segments, paradoxical chest movement. Go ahead and take another deep breath. We could potentially get another set of lung sounds. Breathe, 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 breathe. Do you have any pain in your abdomen?
No.
We're going to go ahead and assess for Dr. Germ. So is there any distension, rigidity, guarding? We're going to palpate all four quadrants. Checking for any eviscerations, rebound tenderness or masses. Moving down to the pelvis, down and in. Checking for stability. Offset pressure on the legs. Float the patellas. We would take, she would already be exposed, but we're going to check for PMS on all four extremities. Pulses. Wiggle your toes. Which toe am I touching?
Big toe.
On which side?
Left.
Which toe am I touching?
Big toe.
On which side?
Right.
Coming back up. On these extremities, we're going to also check for needle track marks, tattoos that may be covering those as well, or any medic alert tags, pulses. Wiggle your fingers. Which finger am I touching?
Thumb. Right thumb.
Which finger am I touching?
Left thumb.
All right. We would go ahead, place a collar, roll patient, assess on the back, palpate the rest of the spine. We would then also check another set of lung sounds if indicated. And we're going to go ahead and also do sacral edema and any incontinence.